Hi, my name is Martin Doyle. I'm a physiotherapist of over 25 years, and I'm here to introduce you to a product, the Biothermared Digital Moist Heat Pad. And luckily some of my patients have kindly agreed to show you how I use the product, allow me to demonstrate the product in the treatment rooms and how we use it on their particular conditions. My first patient is Chris, and Chris has been with me for 10 years.
10 years, yeah.
10 years, and Chris's condition when she presented was an arthritic knee, and you can see how she can't straighten this knee fully. So those clinicians that are watching the program, you can see pretty much straight away that's a classical osteoarthritic knee that probably in the future may need a total knee replacement. But in the meantime, Chris and I have come up with a strength and conditioning program in conjunction with manual therapy that we've managed to maintain the degradation of that knee, and it hasn't increased in its loss of range. Sometimes it does flare up if we exercise it too hard, but Chris comes into the clinic twice a week. And would you like to explain what you do when you come in, Chris?
Yeah, sure. So we exercise for around about an hour and a half. So usually we start with 20 or 30 minutes worth of cardio. So I usually do bike or sometimes cross trainer. And then we do sort of a circuit with weights and floor exercises, do a bit of work on the Swiss ball, do some stretching. And it's we usually work with a group of 4 to 6, and it's great camaraderie, really keeps you coming. I think that what I've found is doing this much exercise has really kept me mobile and able to do other things. So I do a bit of walking. I actually managed to do a 50-kilometre trail trek a couple of years ago. So exercise I think really helps a lot.
And I'd have to say I've been very impressed with Chris's diligence over the years. Even when it's tough mornings to come in with a cold, she still comes in and does her hard yakka.
Yeah.
And just remember, with osteoarthritic conditions, exercise is really important, and the load that you put through the structure is really important so you don't exacerbate the condition. And that's why when Chris is in pain, I use the Biothermared as part of my physiotherapy treatment in conjunctions with manual therapy. Now, Chris is very busy at work. She has a lot of deadlines, so she does get neck and shoulder issues as well. And the product that she purchased is a very popular one. It's a neck and shoulder one. And I'll show you how Chris uses it. But basically it goes round your shoulder here, and you can sit up with this on it. But Chris doesn't need to purchase another one because she wasn't aware she can use this in other areas. So it's quite within reason that when it gets cold or when she's in pain and there's no inflammation there but it's sore, then this Biothermared that produces infrared moist heat will be an adjunct to pain management for this knee. So remember, the product's designed to go on the skin. Unless you're with an elderly patient, then you could put a versatile thin piece of paper or a cotton cover if you're worried about the skin's patient, but ideally it goes on the skin for people of Chris's young age and younger. But also recently, Chris came into the clinic complaining of hip pain, and when we had a closer look, we did some clinical tests that found she was a bit stiff on the Faber's test on both sides, but we didn't think there was any major pathology, but she may have a predisposition to wear and tear in these structures like she's got here. Was this an injury?
No. Well, I did have a skiing injury, maybe 40 years ago, but no, mostly I think it's just
because injuries can be a precursor to osteoarthritis later on in life, or there can be a genetic sort of predisposition.
Yeah.
So for Chris, when we assess the hip, she could use the Biothermared on the hips for pain management.
Yes.
If you lie on your right side, Chris, this is how I'd recommend you to use the hip. So I'd probably have Chris with just in the underpants, and I would have the product wrapped around here. Remember, I always recommend an extension lead.
Yeah.
So the patients, if they're at home or in a nursing home, or if you're an allied health professional in a nursing home or in a hospital or aged care facility, the beauty of these things is you can set the time, you can set the temperature, you can lock it in. And then away you go. So with Chris, I'd probably put that on 15 or 20 minutes on one side, and then roll you over. Remember, it's designed to go on your skin, so probably with these off on your underpants, you'll get that lovely heat here. So you can use that for hip, you can use it on your hip, and I'd probably even use it on the spine as well, because some research shows if there's hip pathology, there's a
Yeah.
strong likelihood there might be a lower back issue there as well. So.